In terms of limiting anterior shear, we need to be aware that anterior shear loading can happen at any time you bend forwards and the superior lumbar segments are pulled forward by gravity on top of one another. We have demonstrated a student sitting in a very slacked posture at a desk. With present circumstances, it has become extremely common to work from home and be staring at a screen for prolonged periods of time. In addition to this, time spent doing physical activity and taking breaks from these screens has decreased. This posture leads to an anterior tilt of the pelvis, another contributing factor to anterior shear of the lumbar spine, as it forces the spine into hyperlordosis. Therefore, the first correction we've applied to limit anterior shear is to apply ergonomic corrections to the student's seated posture, as well as repositioning of the pelvis when the individual is in the upright standing position. We would also advise the individual to take a break from screens regularly and attempt to get out for regular physical activity, as this will contribute to preventing soft tissue injury and reduce anterior tilt of the pelvis. Increasing anterior shear force on the lumbar spine happens with forward flexion and forward bending motions. When the spine is repeatedly put into flexion, the shear load is placed on the front of the vertebral bodies, which compresses the intervertebral disc in between. This shear force is applied during simple things like putting on your socks, feeding your pet, or tidying your house. It also occurs in more complex actions like doing a sit-up or picking up a heavy box. Although these are things we do daily and are often unavoidable, if we do not perform these movements properly, we have a great chance of obtaining low back pain or a potential disc herniation due to the amount of repetitive shear forces placed on these structures. In the two following images, we see two types of postures that would put a significant amount of shear force on the lumbar spine. In the first image, we see the student picking up the box with a very long moment arm, and the box far away from the body, knees are barely bent, and her back curled over towards the object. The student is putting herself in a difficult position to successfully pick up the box, as well as creating a lot of room for injury, as the force would be extremely large in the hips, low back, and shoulders. In the second image, the student has the box closer to the body, which is good, but her whole upper body is curled over the object with little bend in the knees. This will put massive shear force on the anterior portion of the spine while she is lifting the object up. It will be important to be aware of our patients and how they are doing simple tasks like anterior bending and lifting because they're unavoidable motions. But if we educate appropriately, it may reduce the chance of our patients obtaining low back pain and other possible anterior shear force injuries. In this video, we're demonstrating an individual slipping and falling on water in their kitchen. Due to the individual not altering or slowing their gait and repositioning their center of mass, the individual falls and receives blunt trauma to the right hip. After physical examination, the injury was determined to be a sacroiliac joint dysfunction. The recommendations to reduce the risk of this injury are, first of all, altering the gait. To alter gait, the individual can slow their stepping pattern and laterally rotate the feet to widen their base of support. With this widened base of support, this ensures the individual's center of mass is within their base of support. In this video, a gymnast is demonstrating one of their various skills, a backbend bridge. The individual reports training 6 days a week for 5 hours a day, and many of their skills require hyperextension of the lumbar and thoracic spine. After her recent competition, the athlete began to notice a dull ache in her lower back at rest and a sharp stabbing pain when she was performing any skill involving hyperextension. After physical examination, the gymnast was diagnosed with a disc bulge. The recommendations to reduce the risk of this injury are first of all for the gymnast to take a break from the specific skills that are aggravating the pain symptoms. In addition, it would continuously become important for the gymnast to maintain a neutral spine whenever possible. This may include modifying her training program to prevent further injuries and increase chances of a full recovery. Strengthening exercises, with emphasis on the low back and abdominals, should also be incorporated into her programming. In this video, a student has been recorded in their natural sitting position while doing schoolwork. The individual admits to sitting at their desk for 8 to 10 hours a day staring directly at a screen in a hunched over posture and denies incorporating any breaks or time for stretching and physical activity. The student reports a persistent dull ache in her neck, resulting in limited range of motion and consistent headaches. After physical examination, the student was diagnosed with a strain to the upper cervical region and myofascial pain syndrome in the ascending trapezius region. The recommendations to reduce the risk of this injury are to ensure that the individual is taking frequent and adequate breaks, which include stretching and exercise. Some effective stretches may include cat-cow, yoga stretches, and assisted lateral flexion. With this, proper ergonomics are also important in prevention. Sitting upright in a neutral spine, constantly varying positions so that the individual is not in one position for a prolonged period of time. A quality ergonomically friendly chair and/or pillow is another important mechanism. It is recommended to begin the exercise routine with the cat-camel motion exercise or spine flexion extension cycles. This exercise helps to reduce spine viscosity as well as floss the nerve roots at each lumbar level. The emphasis for the cat-camel exercise is in the motion itself, not pushing to end ranges or stretching. All levels of the spine should be involved within the movement and should all move through flexion and extension together. For this exercise, to reduce viscous frictional stresses, perform 5 to 8 cycles. Begin in a tabletop position with both arms directly under the shoulders and knees aligned with the hips. With great control, slowly flex the back up towards the sky, trying to move one vertebral segment at a time. As you arch the back, slowly tuck the chin towards the chest. When you have reached your full flexed position, begin to slowly release and return to the starting position. From the starting position, begin to slowly extend your back segmentally until you reach full extension, while slowly bringing your gaze up to the sky. After you've reached full extension, begin to release into the starting position. This is 1 cycle. Slow potty squats are a stabilization and strengthening exercise which groups motor patterns in the brain to ensure stability in a patient as they are performing different motor activities. This exercise considers spinal loading within the patient's tolerance and appropriate muscle activation levels which are suitable for our goals for the patient. To perform this exercise, grip the floor with the toes while slightly externally rotating the feet. Brace the core to place some tension for stability. Making sure the shoulders are tucked back and spine is in neutral position, push back the hips and flare the knees until a rough angle of 45 degrees is attained. Keeping this position, slowly extend the knees and return to starting position. Nerve flossing is the idea of flossing the sciatic nerve back and forth through the space where the impingement occurs. Flossing facilitates the gradual release of the nerve impingement and helps it move more easily. Start this exercise in a seated position with legs elevated from the ground and swinging freely. Simultaneously, bring your chin to your chest and your knee flexing your foot under the chair in a dorsiflexed position. Then tip your head back and straighten your leg at the same time. Repeat 10 times in a slow and coordinated motion, with each cycle lasting about 5 seconds. Then repeat this on the other side. Laying in a supine position, place hands under the lumbar spine to maintain a neutral spine. Do not flatten back onto mat or floor, as this causes flexion in the lumbar spine and increases loads on the discs and ligaments. Bend and flex one knee, while the opposite leg is straight. This locks the pelvis and lumbar spine and minimizes the loss of a neutral position. To begin, raise head and shoulders off of the floor while tucking in the chin. This motion should take place in the thoracic spine and not the lumbar or cervical regions. Keep your hands placed under the lumbar region to support the neutral curve. To make this exercise more challenging, the elbows may also be raised off the floor. Hold this raised position for 7 to 8 seconds, ensuring to breathe throughout the entire exercise. The side bridge focuses on contraction of the lateral abdominal muscles, specifically the quadratus lumborum and the obliques. These muscles are important for optimal stability. The side bridge exercise is better for the spine in comparison to sit-ups or supermans, as the side bridge still have great muscle activation and stabilizing patterns while having a much lower spine load. For a beginner side bridge, begin in a side position with your hip on the ground, knees bent, and your elbows supporting under the shoulder. From here, lift your hips off the ground to bring your spine into a neutral position. Hold this position for 7 to 8 seconds and then release. The bird dog is an exercise that helps with spinal stabilization and, if done consistently, can help decrease low back pain. This isometric hold is to be held no longer than 7 to 8 seconds, as there is a rapid loss of available oxygen in the torso muscles contracting at these levels. Therefore, short relaxation of the muscles restores oxygen and allows for a more accurate execution of the exercise. The evidence supports building endurance with increased repetitions rather than holding time. Both the lumbar and thoracic back extensors are challenged with this exercise. Only half of these muscles are challenged at a time by lifting the alternating hand and knee. This reduces the spine load to about a half of that produced during traditional spine extension exercises, such as a Roman chair extension. Start on your hands and knees and lift the opposite hand and knee, extending both straight out. Be sure to keep the hips level with the ground by engaging the core muscles. Hold this position for 7 to 8 seconds, then lower the hand and knee and sweep the floor with them. This motion will enhance the stabilizing patterns. Switch sides and complete repetitions.